we are.
Yeah, brilliant. Thank you.
And if Leanne, could you let any, because I can't see the people waiting in the lobby while my screen's sharing. So could you let anybody in from the lobby, please?
That's fine, no problem.
Thank you. Off you go then, Dan.
Do you mind moving it on? Yeah, brilliant. Thank you. So welcome everyone. The aim of today's session is just to kind of talk you through the process around our PSR awards, kind of with the new contracts that's been kind of shared through, I believe, Grant and Charlotte in the newsletter around kind of the changes that are coming into effect. So we're going to go through the current context of the current contract, our specification, what does it mean for your GP practice, do a bit of a Q&A just to kind of understand kind of if there are any things that you want to raise at this time. And then the next part will be around the procurement process. So Gavin will talk you through that, kind of what the process involves, trying to make it as easy and straightforward as possible for you as practices. Where and when you can ask, say, for clarification questions, we'll be setting up sessions specifically for your practice as well to make it easier with the process, what support is available, and then timescales that we're looking at trying to roll these new contracts out. And then again, any Q&A next step questions around that process. Next slide, please, Gav. Like I say, we'll just kind of talk you through the current context of the NHS Health Checks service, so why we're doing this in the first place, introduction of the new contract, support we're offering to help you with kind of the practices and also kind of the work required, how to register on the procurement portal, so practice. Hopefully it'll be a straightforward again process to be able to kind of navigate you through that, and then next steps around the procurement exercise, and kind of how we're going to award the contracts with you and your practice. So yeah, next slide please. So current context of the NHS Health Check service, as you know, we currently commission as public health all GP practices to deliver the NHS Health Check programme. This is in alignment and is a mandated service as part of the public health grant. So we get a grant each year that comes through to us, and then we disseminate the funding and kind of specifically use that funding to be able to deliver the health check service each year and kind of pay you your kind of payment fees for delivery of that service and programme. Up until now, we've not had to do too much to the contract since they started, although recently with provider selection regime processes that have come in at the start of January 2024, we've been informed that the contracts are now in its current state are out of date and need updating. So PSR is provider selection regime. So it's essentially a new legislation guidance that has been issued to public health, but also local authorities, the way we conduct our contract procurements going forwards. But Gavin will talk you through a little bit more about that in the next few slides. Next slide, please, Gavin. So in terms of what we do now, so we currently pay you £20 for a Part 1 completion, which is the main check, and then a further £28 payment is made for a Part 2. So those who are identified as having a Q-risk score of above 10%, which is known as high risk patients, and then kind of following up that, we'll pay you a further £28 in light of kind of identifying those patients as part of the health check. The pricing structure we've based this on is in accordance with the available budget that we get through the public health grant, but also we've kind of carefully benchmarked this against other local authority areas and in alignment with what they pay, but also bearing in mind that we've tried to keep a pricing structure that is fair and kind of reflective of the work that you do. So keeping that two-tier pricing structure, we feel that it's reflective of kind of the price, but also kind of the effort that you go to inviting patients, and kind of we want to make that as kind of clear as possible in terms of we've tried to keep that pricing structure in terms of this new contract, which we know other authorities have kind of gone to a one payment process model, which is obviously kind of not what we want, and that's kind of something that we've made sure to keep going forwards. And we're constantly reviewing ongoing need based on suitability of the offer, how this meets demand, and access for both eligible and targeted population. So again, we know that 50% of our population have received a health check in the last 5 years, but we also know a further 50% are also eligible and potentially not uptaking that offer. So we want to make sure that's reflected in the delivery of health checks and how we can target populations within your eligible patient cohorts around kind of how can we identify those patients that are perhaps not having a health check. And again, that finance and funding model has kind of been there to reflect that process. Next slide, please. So the main elements of the current specification, as you know, it's a universal offer for the eligible population. So roughly in Leicester, we've got around 90,000 people estimated and eligible for an NHS Health Check. This is for those who are 40 to 74 years of age. That's obviously remaining in terms of the process, and it's for those who are without a pre-existing medical condition or already on a clinical risk register. And kind of again, as you already do, every individual should be invited at least every 5 years as part of that service. Some of the changes that we've tried to reflect in the new service specification is kind of updated it based on the PCN approach that we know some practices deliver already. So ensuring that patients can have increased access if maybe they can't attend their own practice at a time or date suitable, they can attend another practice within their PCN to ensure that kind of is made as easy as possible. So we've kind of articulated that in the service spec. Ensuring a proportionate universalism approach, so a very public health related term in the sense of identifying those kind of at greater scale and need within our population. So how we think about inviting patients, engaging with patients who may not kind of be aware of the program, but also maybe not attended their practice in recent times. So how can we do more to help them have their health check? And that's something that we want to work with you on going forwards. And then continued improvement around the health check template. So hopefully kind of everyone's aware now of the LHIS templates that you use. Hopefully these are made easier, more time effective, more cost. They're ensuring payment is made easier in terms of kind of getting payment to you a lot quicker and time effective, and kind of ensuring that those templates are easier to navigate in order to kind of get that health check payment each quarter. And then finally, something that again we're still kind of waiting to see how this unfolds, but the integration of the proposed digital health check offer. So this will look to sit alongside the kind of the main health check, but kind of as an additional way for people to get their health check. But that's kind of we're waiting to see kind of how that unfolds. Next slide, please, Gav. And then lastly on my slides, it's kind of what this means for you as a practice. So we kind of want to obviously work with you going forwards and continue to deliver the health check services before. So nothing dramatically is intending to change with this process. As I've said, if we just kind of renew those contracts for in light of the PSR guidance that has come into effect. We want to make the contracts as long as possible within local authority kind of parameters. So that is 7 years. So this will be a continuation of the programme for a further 7 years with that supplied funding going into the service that we commission you to deliver. We want to ensure the reprocurement process is again made as simple and straightforward as possible. And again, I'd just like to thank my procurement colleagues for kind of allowing and kind of setting this session up, but also the processes to streamline the documentation that we've tried to pull together and make it as easy as possible for us to be able to kind of work with you in order to sign those contracts in, I say, the best way possible. And then look to work with ourselves again around that process and kind of booking into those workshops, those sessions, to be able to, if you've got any questions or need any help, we're here to support you with that process. And then lastly, just continue to work as normal and kind of to be paid and support you as much as possible. Next slide. And if
Any
anyone's got
questions?
any questions, then yeah, fire away if you have any.
I can't see if any hands are up, unfortunately. So no. Okay.
Not at this time, Gavin.
Not this one. Okay, so it's my turn now. So yes, thank you, Dan, for that overview of the NHS contracts as they stand at the moment and how we're going to be moving forward with the new contracts. So I'm going to talk to you a little bit now about the process, when and where you can ask for clarifications, what support is available, and what timescales that we're going to be working in. So as I say, I'm Gavin Yarnold, I'm the service manager, I'm the procurement lead, and I've got a support team, Leanne, who's been fantastic at shortening the response document to make it a little bit easier for you guys to complete. And she's been working extensively with our legal team as well to ensure that the contract that you'll be signing is robust and is exactly how you would expect to find it. And Robbie is going to be helping us with the technical side of things. So we use a system called Proactis, and Robbie will be available to help you with any technical problems that you might have, logging in, registering, uploading documents, etc. So the three of us are going to be available at several different sessions, which I'll get to in the next slide. I'm jumping ahead of myself here. So what does this mean for you? Your Proactis registration. Off the back of this meeting, I shall send you a link in an email, and in that email I'll put this presentation. There will also be a recording and there will also be a transcript of this presentation, and I will include a link in that email to this screen. And what this screen will do is ask you to register free with Proactis. You follow the steps accordingly. You need to enter your surgery details, your company details, etc. The usual things that you would expect to be asked when you are registering your organisation or practice onto a system such as this. This isn't a competitive tender exercise. You are being awarded a contract directly. So there is no competitive aspect to this project at all, and there is also no commercial advantage to any of the contracts. They are all the same. The only difference with the contracts will be the front end, which will contain all of your surgery and company details. So this is not a competitive exercise. You're being directly awarded a contract through our Proactis system. So next week, there will be several time slots made available for technical support for everyone. And this is to get you to onboard and register onto the Proactis system. So Leanne, Robbie and myself, Charlotte will distribute a list of dates and times that we will be online and available to help you. So all you'll need to do is email Charlotte and tell her the slot that you'd like to meet with us, and we will send you an invitation from our calendar, and you'll be able to log in, join us, and you can share any problems that you might have registering. You might just want to have a chat about things that you need to upload, but we're going to be there on hand to help you every step of the way. So please don't worry about register on Proactis. It's very straightforward, but as I say, technical support is available with us. And alternatively, there's further support if it's really technical. There's also, of course, the Proactive suppliers, proactis.com, and they are also on hand to help you out. But I'm sure that myself, Robbie and Leanne will be able to guide you through the registration process. So what is Direct Award Route B? Now, as you may or may not know, new legislation was issued from the government in February, and it's called the Procurement Act 2023. And under Procurement Act 2023, there are a number of new pieces of legislation and procedures and processes that we are now able to utilise in order to do a contract direct award. Now, there are three different direct award routes: A, B, and C. A is basically where you haven't got a supplier available and you've got a justification to do a direct award to the only supplier in the country that can do what you want to do. So you'd use supplier route A. Supplier route C is when you're doing a direct award to an existing contract and you want to either extend or give them a new contract. So you'd use direct route C, and that would enable you to plan for a tender moving forward. Director Award Route B, however, that refers only to a process for healthcare services. So the provider selection regime here, it means that patients have a choice of providers. So this is the GP surgeries. There are no restrictions on the number of available providers, so we can have as many or as few GP surgeries on this contract, and contracts are offered to all who meet the requirements. So with your response document, you will be telling us what you do, and those will meet the requirements of what we need you to do, and we will basically issue the contract based on the information that you provide us on your response document, which I'll get to. But this route is specifically for health providers where the patient can select from multiple qualified providers, ensuring all capable suppliers can access the contract without arbitrary limits. So this is a very straightforward exercise. In past doing direct awards, we would have to do a lot more due diligence and a lot more checks around it, but obviously we're currently working with the GP practices on the previous NHS Health Checks contract, so we're confident that there shouldn't be any issues giving you your new contract under the Direct Award Route B provider selection regime. So the administrative phase, the boring bit. Following this session, then the email that I mentioned earlier will be sent to everyone in this meeting, and this will contain instructions to register on the portal. The documents you are required to complete will be sent to everybody on the Proactives portal, and this is going to be called the response document. So this is the document that I referred to just now. Leanne, she's worked hard with our legal team to cut down the response document to make it as easy for you to complete as possible and in as minimal time possible. So yes, we've cut that down, and you will receive that document. It looks a bit scary, but actually once you get into it, it's very straightforward what you are required to provide and give us on that response document. It's a series of yes and no questions, and yeah, go through those, and if you have any problems, as I say, technical support is available throughout the time that you are going to be registering on the Proactive system. You have a lot of time, actually. We've given you 2 to 3 weeks to register and complete the response document. And as I say, you are going to have the 2 to 3 weeks, and they should be submitted by the 14th of October. Once we've got all of the response documents in from all the GP surgeries that are going to receive the contract, we will issue the actual contract for signing on receipt of all the response documents. So once we've got all of the response documents in, there will be a big tranche going out with all of the contracts. We aim to have all the contracts issued to your surgery by the 21st of October. You will have another 3 weeks to sign and upload your contract for counter signature. So you will have a contract, you read, review, and then you will sign. You will upload onto either the portal or via DocuSign, and that will be submitted to us for counter signature, and then we will reissue all of the countersigned contracts at the same time on the same day, so that everybody has everything at the same time. There will be technical support sessions available throughout this time as well. There will not be a scope for contract negotiation. Unfortunately, we will require contracts to be signed as is. As I say, there is no commercial advantage to any of the contracts. They are all the same terms and conditions. The only difference, as I say, will be the front end, which will contain your details about your surgery and your organisation. So once we've awarded your contract, there will be a contract award notice, and that will be published the week commencing the 1st of November 2025. This is basically a new piece of legislation where, well, it's not new, we had to do it before, but now we've got a new system where under direct award provider selection regime, we publish a contract award notice to let everybody know that we have issued that contract. As I mentioned, countersigned contract will be issued in one day, meaning you'll receive all of those contracts on the same day, and there is no commercial advantage to any contract. Your new contract is scheduled to commence on the 1st of December 2025. That isn't set in stone. We understand that holidays, sick leave, and unforeseen circumstances can mean time scale slip, but we aim and we hope to have all of the health check contracts commenced by the 1st of December 2025. any questions? That is the end of the presentation. Okay, let me see who's got their hand up. Vicky.
Hi.
Hiya,
So-
nice to meet you.
So none of the NHS check data or anything needs entering on this portal. This is literally for us to sign up.
No, there will be a response document, and that's going to be sent via the portal. So the response document is where you will enter your GP surgery details, your CQC.
No, I don't mean like NHS. When we actually do an NHS health check,
Oh,
that's on,
sorry, I beg
so
your
that's
pardon.
on
Yeah.
system one all the same.
Yeah, that's staying the same, Vicky. So nothing's changed in relation to that. This is just the contract, renewing the contract that you've got with ourselves as public health.
So we've got to do this once every 7 years. So we're actually going through all this training just to sign a document.
It's not necessarily training, Vicky. We're just offering you the support enabled to you to do it. That's all. You haven't got to join any of the sessions. Basically,
No. What I mean is, we have been doing NHS health checks for the last 10 years.
Yeah.
And we've just been sent to CBS, sign this, your senior partner, and we're done.
Yeah, and that's pretty much what we're going to do this time, but we've got to do it with under the new legislation. So we're reissuing a new contract under Procurement Act 23, and we have to demonstrate that we have used a compliant route in order to award your new contract. So a lot of the stuff that we are doing in procurement is basically because of the new Procurement Act 2023. Your current contract is no longer fit for purpose. So the 10-year contract that you've had at the moment is going to be replaced by a new compliant contract, which has been awarded via the Provider Selection Regime B. And I've given you that information because I wanted to put it into context why we're changing your contract. It is merely an administrative process, that is all. So all you need to do is register, fill in a form, we'll issue a contract, you sign it, you send it back, we countersign it, and then that's it for 7 years. In layman's terms, that is what the process is.
Is this going to happen with LARCs as well?
Yes.
I'm afraid so, yes.
For the same
as
reasons.
practice managers, and thank God I'm not going to be around in 7 years, you've got to retrain practice managers to be able to use and register their surgery on this portal to use it once every 7 years.
It's not really training, Vicky. It's more a support. It's very straightforward registering on Proactive.
I don't mean, no, what I mean is practice managers then are being given yet another portal that we're going to use once every 7. Charlotte, do you see where I'm coming from?
Microphone, Charlotte.
Sorry, I hit the wrong button. Yeah, completely understand, Vicky. Unfortunately, we had the kind of conversations with the team, but there wasn't, due to the kind of the change within the Procurement Act, there was nothing that, well, we felt we could do further on this, but I completely recognise your point.
So every contract that we've got for CBS,
Not
LARCs,
CBS. This is obviously just the council, and it's particularly just the city.
This will be for like nationwide as well, Vicky. Like this isn't just local. This is national. Like
this is crazy.
Hopefully, Vicky, it's a straightforward process. As Gavin said, but
Claire, I understand it's a straightforward process. I can read a document, I can put an electronic signature onto it, and you can keep it on your files. Straightforward process. Once every 7 years for any, so I'm going to have to do it once for the LARCs, and then in 7 years' time, I'm not going to be here. The next practice manager is probably not going to be here. This is yet another computer system. This is the NHS digital at its worst. This is a program that we've got to keep a password and a login for to use once every 7 years.
Well, this is a contract. So you're signing a contract to kind of say that this is able to be delivered. For
I can do that in 2 seconds on a piece of paper.
And hopefully
And
it'll
I'll
be
email it
straightforward.
back.
And hopefully we'll make it as straightforward as possible for this process as well. We're not trying to overcomplicate anything here. We're just trying to make sure that our contracts are updated, our service spec is updated in line with what is being delivered currently. That is now 10 years out of date. Well, they say that's been running for 10 years and has not been updated. We want to make sure that that is reflected in the current service specification and delivery of that program. We appreciate that it's an admin ask, but we feel that well, it's needed from a legislation point of view.
And the reason we went for the 7 years is because that gives you you don't have to keep doing it. It saves you the time. We wanted to give you a lengthy contract so that you had that security for that longer period of time, rather than coming back to a new contract every year or every 2 years. That's why we've gone for as long a contract as we can.
I understand that, but I won't have to log in, and I won't have a chance of remembering a password in 7 years' time.
That's okay. We will help you, or whoever is in place, to do that in 7 years' time.
Don't worry.
We'll do this whole process all again with whoever is in place.
Okay.
Caroline?
Thank you.
Thank you, Vicky.
Thank you, Vicky.
Caroline.
Hi guys, my camera's getting there slowly.
Hi.
My question was, is there any change to the fundamental contract that we're being provided? So are there any new requirements, any new changes to the amount of times we've got to invite people in, anything new in the actual contract itself?
Not explicitly, Caroline. It's more on just kind of trying to reinforce that message around trying to target those eligible populations that are perhaps not engaging with your practice, or kind of doing that more targeted work to hopefully bring about those higher risk patients, so those patients that would warrant a £28 payment into your practice. That's where we're going with it, but we've put that in the specification that we'd like to work with practices to do that over the course of the contract.
So there is a change to the contract and what we're being asked to do?
No, that's an informal message from myself in terms of the contract has not been changed from that point of view, but we want to encourage that way of working kind of with ourselves as public health and kind of with yourselves as GP practices, and that's something that we're taking offline to have those discussions, but nothing formally to the contract.
Lovely, thank you.
Thank you.
Thanks, Caroline. Holly, you've got your hand up. Hello, nice to meet you.
Hi, nice to meet you. So is this everyone will have to do this in the city then? Every practice is going to have to complete this, obviously, every 7 years. I look after 3 practices, so I'll have to do it for 3 practices, obviously off. Well, am I allowed to do that off one login?
Yeah.
So one login, I can have multiple.
You would have one login and you would register. Leanne, are we able to do that? Leanne and Robbie, we wouldn't. I don't think we'd have Holly having 3 registrations and having to fill 3. How would we do that, Leanne?
I think you can just log in with you can create a 1 account, and then you can add the information for the 3 GPs on that 1 account. Yeah.
Okay. I think it's just going to be. What's the timeline for this procurement to be complete? So when are you wanting, obviously, it complete for every practice across Leicestershire?
I'd like to get the contract signed by the 1st of December 2015.
Okay.
So yeah, you've got. I've given you around 3 weeks to register on the portal and another 3 weeks to get the contract signed, and then we will countersign and the new contract will commence on the 1st of December. All being well.
Okay. Yeah.
Well, and just to be clear, the one that we're doing is just for Leicester City. So this will happen, or has happened, for Leicestershire and elsewhere in the country, because everybody has to be compliant. Yeah. But this is just about Leicester City.
How did they find those timings then? Because I know, I'm very with Vicky, it's not really my friend having 3 of them. So trying to find time where I will be able to be on a portal and complete all of the forms that you'd like, and when I could sign a piece of paper and scan it back to you was really difficult. I appreciate it's obviously changing, and this is the way that it's going to have to go. But was that 3 weeks to get all of Leicester City practices engaged and understanding the change? Because obviously there's not a huge amount on this call. Is that going to be sent further afield and things like that?
Yeah, well, as I say, there is support. What we'll do, Holly, with you particularly, if you want us to, we can put a couple of hours, an hour in the calendar, one-on-one, and me and you can go through everything you need to do together, live on the screen. Block an hour out. Me, Robbie, and Leanne will be there, and we can help you get all 3 of those forms completed in an hour or 2. So please don't worry. I can't emphasize enough. I understand it's a big administrative exercise, but we are here to help you. Now, we can adjust timelines to suit, but as I say, I put the 3 to 4 weeks in just from my own. That was just my own guesswork, if you like, based on previous projects that I've worked on to do with NHS. However, Holly, I'm more than happy to accommodate a few extra weeks on the timeline if that is what is required from all of the surgeries. And as I say, that technical support is going to be open to everybody. So please don't worry.
Thank you. Thank you.
Thanks, Holly. Helen, you've got your hand up. Hello, nice to meet you.
Hi, nice to meet you. Mine's just a quick question. How much time is going to be needed to fill the forms in? And is it just a case of filling forms in, or have we got to upload varying different types of documents?
The form itself is it's just yes, no, have you got this, have you got that, have you got this, have you got that, and there will be it's very easy to I know it's I think I say this because I do it all the time, but there's an upload button, and it will help you find the document. It will go into your documents, and you can literally pull that document out of that folder and drop it into the system, and it will upload it for you. It's very, very straightforward, and I understand that it's really boring uploading certificates and documents and evidence, but unfortunately that's what we've got to do. And as I say, Helen, if you book in a slot with us, we can put your screen up, and we can tell you exactly which buttons to push, where to upload things, where to find things on your system, and you'll be able to do that with us in a live environment.
What type of documents? Because obviously for a lot of us, we've got some that we've saved on the hard drive, and then we've got some that are pieces of paper that are kept in a folder type thing. So I'm trying to get a rough idea of how much is needed so we can plan time. Because I know you say 3 weeks, but then like Vicky said as well, like if I've got someone here, and will there be a list at the front saying these are the documents you need to have so we can plan beforehand? Just trying to streamline it.
What I'll do, Helen, in the covering email that I'll send out after this meeting, I will put in a summary of the kind of documents that you're going to have to dig out, basically. And I'll give you, what I won't do is then send the documents out straight away. I'll give you the time to pull that information from the different systems that you've got from a file, so you can copy it, and then give you a good couple of weeks to pull those documents together. Then I'll release the document. And then you can fill that in, book some time in with me and go, Gav, I've got this, but I haven't got that. What shall I do about this? And we can help you. The whole point of this today is to tell you that we're not just going to fire out a load of documents to you and leave you to fill them in. That's not what this is about. This is about making this we want as least disruption for you as possible. So that's why myself, Robbie and Leanne, we're offering this support function. So don't worry, Helen, we will help you every step of the way and guide you through. So please don't worry about that. And we can pick up it straight off this. We can pick up and have a half-hour meeting together, Helen, before you even start if you want to. All you need to do is email me, reach out to me, and I will give you the help and support that you need to get this over the line. Nobody needs to worry about anything.
Thanks, Gavin. There's a couple of questions in the chat, which I think you've now answered, which is that you're going to send out an email listing all of those documents so people can begin preparing. The other question in the chat is from Vicky, and that is about are GP surgeries only going to be seeing their own patients still, or will it move to people can go wherever? And Dan, did you want to pick that one up?
Yeah, that's fine. So yeah, as mentioned before in the specification, we put in there around the PCN approach. So I'm aware that PCNs and practices do work together to kind of offer for other eligible population patient lists. So it's entirely of how you work within your PCN, Vicky, in that way. And that's kind of, again, if you want kind of support of kind of how other PCNs have done it, because we are aware of models out there that kind of they've done it. So through extended access plans, one practice is offered to post health check kind clinics for other practices. Did you want to come in, Vicky?
So how are you extracting the data then on the payment side?
So that's been happening for the last couple of years. So what happens sometimes is that PCNs will send their own data. We will cross-check it with our system, with System 1 in the health check templates, and make sure that that's aligned to being able to offer more than just your own practice. So if, like I say, if you need some insight around that, I say take this conversation offline and help you kind of understand that a bit more.
So it's agreement between your PCNs whether you're sharing patients or not?
Yeah. So I don't know, other practice managers on this call might have already begun those discussions or have that model in place now. So kind of how that's been done with other PCNs, that would probably be best coming from themselves.
Are you saying that it can be done? Obviously, some PCNs do it collectively, and then some obviously. So we don't. I don't. I mean, Vicky, I don't think you do. We do our own patients.
Yeah.
Okay. Yeah. Whereas other PCNs and practices, they'll do it collectively as a PCN.
So Leicester City Council is not going to be doing a media thing, so telling patients they can go to any surgery or any pharmacy. It's we're still in control of that.
Yeah. Absolutely.
Oh, okay.
Yeah. That is totally your decision. Yeah. Absolutely.
Okay. Thanks.
That's okay.
Any more questions from anybody? Okay. So next steps from us then is going to be, like I said, I will send you all on this call and the other practices that couldn't make the meeting today. I'll send you a summary email and it will have a copy of our presentation for you to have a look at again. And that just gives you the key dates that we're aiming for. As I said to Holly, these are movable if required. The main takeaway I want you to take is that we are here to support you. It is an administrative exercise, but once it's done, you've got 7 years and you won't hear from me again. So that's the good news. But as I said to you, Charlotte and I will be managing a diary where we will be available to help and support you. So please do take advantage of that, because, you know, once you're on a call with myself, Leanne and Robbie, we can just literally go push that button, upload that, do this, do that, do this, do that, and enter, and it's done. And then literally then you'll get your contract and all you'll need to do is sign it. So it's just this initial part that seems a little bit like a big mountain to climb. But like I said, with our support, we want to help you every step of the way and make this as painless as possible. And I know this introductory meeting's a bit like, oh, what's happening? But trust me, Leanne and Robbie are going to help you, and Dan and Claire as well, with any problems that you've got. We're here to resolve them immediately. Thank you so much for your time today. I really appreciate you joining us on the call, and thank you for your feedback and your questions. And as I say, within the next 5 working days, I'll have crafted an email that I'll send out to you. It'll have all the documents that we need you to find for us. It'll have a link to register on the Proactis system, and we'll have a summary of our conversation today and also a recording of the meeting for you to share with your colleagues. Any final questions before we end the session today? No? Okay. That leaves me to say thank you very much. And I'm looking forward to seeing you again over the coming weeks in the support session meetings, which I hope to see you at. Lovely. Thanks, everybody.
Thanks very much.
Thank you, everyone.
Bye.
Thanks. Bye.
Thank you. Bye.